Good evening, Professor and class. My name is Rita Boateng, Master of Public Health candidate with a concentration in global health. So before I get started on my practicum, I would like to talk briefly about my practicum site. So I conducted my practicum with a nonprofit organization named Catherine's Family and Youth Services, which is based in Baltimore, Maryland. They are dedicated to serving the low income families and youth within the Baltimore area with services that will improve the overall quality of life and family, which was very perfect for what I conducted my practicum on because Baltimore City is known to have one of the highest HIV rates in the United States. Which brings me to the title of my practicum. So I named my practicum HIV/AIDS Awareness Program in Maryland, Baltimore, Washington metropolitan area. The next slide goes into the overview of my practicum. So HIV is still one of the most significant public health issues worldwide. So out of a 1.2 million annual estimate, almost 1 in 8 are unaware of their infection. So I conducted a cross-sectional community-based HIV awareness survey, which assessed the target group's prior knowledge on HIV. My my results indicated that out of the 30 participants, all 30 had heard about HIV and AIDS before. My results also indicated that 53% of the respondents did not know what HIV stood for. 93.3% of the respondents believed that AIDS was a sexually transmitted disease. 60% of the respondents believed that HIV could only be transmitted sexually. In comparison to females, a higher number of the males were less knowledgeable in HIV and AIDS. Lower levels of education of the respondents was found to be significantly associated with not knowing what HIV stood for. This study sheds light on the strong need to increase awareness and knowledge of HIV and associated risk factors among communities in the Maryland, Baltimore, Washington metropolitan area. So my next slide goes into the purpose of my practicum. As I have previously stated, it is very heartbreaking to witness HIV and AIDS cripple many people in our own communities due to ignorance and lack of preventative measures, especially when there is adequate knowledge and information that can be applied to ensure prevention and control of the disease. Therefore, my practicum was designed to focus on bringing HIV awareness to the target populations and youth between the ages of 13 to 25 years in the Baltimore, Maryland, Washington metropolitan area. My goal was to assess the prior knowledge of the target population and to help promote health and reduction of illness by education of the target population. The purpose was to bring awareness to the most vulnerable population and to assess and talk about the risk factors of the disease, which will hopefully propel an increase in screening participation. My next slide will talk about my methods and design. So I was able to recruit 30 participants in the cross-sectional community-based survey, and the questions had about 20 survey-like questionnaires, and I had participants between the ages of 13 and 25 years. I also collected their social, demographic, and behavioral information. So anybody that was recruited, I sent them a link via email and they were able to access the survey. So every time each participant finished the survey, I received a notification. So I was able to see their responses to the survey. I also collected their demographics such as their age, their sex, marital status, and educational background. So after each participant had conducted the survey, they were able to fill out a time slot where they contacted me and we talk about the questions, if they had any burning questions, the risk factors, and anything that they did not know about HIV. So we pretty much just discussed thoroughly about the survey and all in all questions they had about HIV and AIDS. So after all the questions had been answered, I also discussed with them about the ABC approach, which is one of the best approach which has been used for many years now, being used by many HIV programs. And so the ABC approach, which stands for abstinence, being faithful, and using condoms, has been known to work for a lot of HIV programs. So I decided to incorporate that in my program as well. When I was speaking to people about it, we used the ABC approach, and we talked about the options of either abstaining from sex, being faithful, and using condoms. So my next slide just gives a brief overview of the sample questions. So some of the questions that the questionnaire asks is, what does HIV stand for? About how many people are currently infected with HIV worldwide. AIDS is a sexually transmitted disease. True or false? What is AIDS in reference to HIV? Have you ever been tested for HIV? And these are yes or no questions, multiple choice questions. Anybody interested in taking the questionnaire, I will leave a link underneath and you will be able to access it and also take and assess your knowledge on HIV. I will recommend everybody to try taking it because you will really be surprised about how much you may not know about HIV. My next slide shows the results of the demographic variable. So I did not interview anybody who was less under the age of 13 years old. I interviewed 2 people between the ages of 13 and 14, 3 people between the ages of 15 and 19, and 25 people, which is majority of my respondents, were between the ages of 20 and 24 years old. I had 13 males and 17 females. 28 were single and 2 were married. Nobody was divorced. Education wise, 25 had completed high school, 22 had completed college, and 7 people had completed some form of graduate school. So my data also suggests an association between education and HIV awareness and knowledge. Most of the participants with a college degree or higher answered most of the questions right. Thus, I concluded that there is a positive correlation between HIV and AIDS awareness and an increase in education from the results. The next slide shows a pie chart which illustrates the percentage of some of the selected questions that were answered correctly by the respondents. So 93% of the respondents answered correctly that birth control pills was insufficient in preventing HIV transmission. 96% knew that having multiple partners increased the chances of contracting HIV. New HIV infections usually stems from people who are aware that they are HIV positive. So approximately 75% of the infected persons in the US. And those who are unaware of the HIV statuses, which is approximately 25% of the population in the US. So according to the results, 96% of the targeted population answered correctly that having multiple partners increased their chances of contracting HIV. However, only 80% admitted to still having multiple partners, justifying that they use protection every time, thus making it okay to have multiple partners. Additionally, adequate experience supports the observation that the mere knowledge of HIV does not automatically lead to behavior change. While 100% of the participants have heard of HIV and AIDS, after completing the survey, 90% of them admitted to not being aware of something concerning HIV before they took the survey. So my next slide goes into the recommendation aspects of my practicum. So my data was extremely limited in the sense that it did not represent the whole general population of the Maryland, Baltimore, Washington metropolitan area due to the sample size. But the fact that the data was obtained from the very age groups and education levels was a strong indicator for the need of increased awareness of HIV and AIDS within the most vulnerable population. In terms of increasing HIV awareness and knowledge, awareness promotion should be geared towards understanding the population's reaction to HIV and AIDS knowledge rather than knowledge itself, which can serve as a critical determinant of behavior change. Additionally, the gap between knowledge and preventative measures suggests the role of free condoms and other aspects of safe sex, which should be emphasized in all HIV and AIDS education and awareness efforts. Other preventative aspects of HIV and AIDS, such as the use of condom and increased participation screening and stigma reduction, are needed beyond the HIV informationals. So I also spoke a little bit about biblical wise. So in Galatians 6:9 to 10, the Apostle Paul instructs us to let us not become weary in doing good. As we have opportunity, let us be good to all people, especially to those who belong to the family of believers. And I think that's exactly what, as public health practitioners, we need to be doing, because HIV is such a distressing disease, and we can help anyhow. It's not just in the United States, it is worldwide. And the little that we do as public health workers, it counts towards the greater goods. I think we should continue to do the good that we are doing as Christians and as believers and as future public health workers. And the next slide is my references. So thank you so much. I hope you enjoyed my presentation on HIV awareness. If there are any questions, you can put them in the comments below. Thank you. Have a good night.